presentation for the employees of Healthy Minds Counseling Services for the benefit plan beginning January 1st, 2025. My name is Bill Hammett. I'm proud and honored to be your insurance expert. Along with me are a team of people assigned to your case, Anna and Araceli. All of us are available to you now and throughout the year if you have questions, you need help understanding the plans, what's best for you, claims issues, lost ID cards, finding doctors, whatever it may be. We're here for you. We're going to go through our timeline of open enrollment, the medical, dental, vision plans available, quick tutorial on how to enroll and where do you go with questions. Our open enrollment begins November 18th and runs through November 26th. This is the time in which you are eligible to enroll, make changes, whatever it may be, add dependents, upgrade your plan, downgrade your plan, whatever you need. Any changes that you make would go into effect January 1st. And we're asking everybody to be done no later than Tuesday, November 26th. We understand that some of you might need a little bit more time than that. If that's the case, just please let Tati know, and she will let us know to keep the portal open for you. We're just trying to get this done before the Thanksgiving holidays so that any changes that are made are in the system and you're ready to use them as of January 1st. You will complete your applications at the online benefit enrollment portal called EASE. We have 6 plans available. We have 3 Harmony HMO plans. Harmony HMO is a Sharp Health Care-based HMO plan. And we have 3 PPO plans, a PPO Gold, PPO Silver. These are standard PPO plans with copays for doctor visits and prescription drugs, as well as an HSA plan in the Bronze category. Bronze can be very high deductible. And an HSA plan means that you are eligible to put money aside into a separate tax savings account should you need to use it. The money that would go in that account would be yours as the employee. Your employer is not contributing to that. And as an employee, you would set up a separate account on your own as an individual, not through the company. Here's a quick look at our 3 HMO plans. As you can see on the left, we have our Silver plan. This is going to be your lowest cost option. You got a much higher deductible of $2,400. You have a much higher out-of-pocket maximum of $9,200. An out-of-pocket maximum is the number in which you no longer have to pay anything. If you were to have $100,000, $1 million of expenses, once you have paid out of your pocket a total of $9,200, the insurance company covers 100% of everything for the rest of the calendar year. Notice this Silver plan is very, very good in terms of the physician services benefits. Notice that term DED waived that is next to each of these benefits. This means that the deductible is waived should you need to see a doctor. A primary care visit would be $60. A specialist would be $95. Lab work is $45. X-ray, $45 deductible waived. If you need a CAT scan, PET scan, MRI, $400 copay deductible waived. Physical therapy, occupational therapy, speech therapy, $60 deductible waived. Chiro deductible waived. Urgent care down here at the bottom, also deductible waived. So really, really fantastic plan for those of you that don't have a lot of major health issues, but want something to protect you in case, the major issue were to happen. And you do want coverage for your basic stuff like doctor visits, lab x-ray, scans, physical therapy. Really nice, really valuable Silver plan here. Our Gold and Platinum plans have 0 deductible. Gold plan is a $7,500 out-of-pocket maximum. And the Platinum plan, very low maximum cost of $4,000. So if you know you got a very expensive year, if you know you're going to be running through tons of claims, this $4,000 maximum out of pocket is fantastic. Notice the copays are much lower with these plans. No brand name drug deductible. And with the Gold plan, you got a flat dollar contributions for, or flat dollar copays for hospital stay, surgery, and emergency room. Here's our PPO plan. Here's our Bronze plan, $6,000 deductible. Notice everything is after the deductible. So while this PPO Bronze plan is going to be very attractive from a price standpoint, please know that you are paying 100% of all your doctor visits, prescription drugs, hospital stays, surgeries, emergency rooms, lab, x-ray, all of it, paying for all of it up to $6,000. And then we got our Silver and Gold plans. These are going to be a little more expensive. Silver not quite as expensive as your Gold plan. But your PPO plans are really great for those of you that maybe don't live in the state of California, maybe those of you that do a lot of traveling around the country and want to be able to access regular medical care from, Phoenix, from Detroit, from New York, from Miami, wherever you may be in the country. PPO plans give you a national network of doctors to choose from. Here's the United Healthcare app. This is the single best thing you can do to improve your benefit experience is to download the app to your phone. When you download the app, you always have your ID card. You can access a doctor 24/7. You can look up your benefits, find options nearby. Really a fantastic way to improve your experience. Added value benefits here. So we've got an EAP plan as well. So this can help you with things like work-life balance, alcohol and drug abuse, family issues, marital issues, anything basically that you need some help with on outside person. This is a really great opportunity and option for you to look into. Great place to start your mental health journey. The Apple Fitness app is available for free for 12 months as a United Healthcare member. So highly encourage you guys to download this to your phone. Usually costs about $80 a year, but with United Healthcare, you get it for free. OnePass is another really great option for those of you that like to access lots of different gyms. This is kind of like the Uber Eats, but for gyms. So maybe one night you want pizza, maybe one night you want Mexican, maybe one night you want Chinese food. Same thing with the OnePass. Maybe you want to do Pilates one day. Maybe you want to go to a lifestyle fitness the next. Maybe you want to do some sort of CrossFit training another time. So there's lots of different options you can enroll in. And this gives you a really nice discount to all of them, even down to the $10 a month for a digital only plan. So if you just want that workout from home type stuff, you can do that as well. Our dental plans are with Delta Dental. We have 3 HMO dental plans. HMO dental plans are fantastic because it's a very low price point. You're not asked to pay a whole lot for the premium out of your paycheck every month, and you get your free cleanings. You get a very steep discount on a lot of services. Everything's a copay. Those are the positives to a dental HMO plan. The drawbacks are there not as many providers available to you. So if you've got a very specific provider you want to go to, you might find that this provider is not in the HMO network. If that's what you want to do, we've got our PPO network. We've got a silver, gold, and platinum plan. All of these are fantastic because they got tons of choices of dentists you can go see. But the drawback is you pay a lot more for it. So PPO dental plans give you a lot more choice, but they ask you to pay more out of your paycheck to use the services. Also, dental PPO plans have a calendar year maximum. So with our PPO Silver plan is $1,000 a year max, PPO Gold $1,500, Platinum is $2,000. This means that once the dental plan has spent and paid out on your behalf this dollar amount, they are no longer going to pay, and you have to pay everything else for the rest of the calendar year. So that's why your Platinum and Gold plans have a higher amount than do Silver. They will also cost you more. Please note the Platinum plan uses the Delta Premier Network, which is one of the largest PPO networks in the country. So if you got a very fancy dentist that you want to see, the Platinum plan might be the way you need to go. Our vision plans are with VSP. Both of them are fantastic vision plans. Both of them are very, very similar in a lot of ways. Now, this yellow arrow is pointing to where the big difference is. So this arrow points to the frequency in which you get to access certain benefits. So that first 12 indicates that every 12 months you are eligible for a $10 copay for an annual eye exam. So once a year, $10, same with both plans. The second 12 indicates how frequently you're eligible for your $25 copay for lenses, once every 12 months, both plans. Now, the last number is how frequently you have access to your frames allowance or your contact lens allowance. With the gold plan, it's once every 2 years. With the platinum plan, it's once a year. Okay, so this is very important. With the platinum plan, I get a $250 frames allowance once a year. With the gold plan, it's less at $200 once every 2 years. Same with the contact lenses, 180 versus 200. This is why I say the platinum plan is a better value. The difference in premium is less than $2 a month between the gold and the platinum. Yet the Platinum plan gives you more, a lot more. Access to frames every year, access to contacts every year. A lot of people will take the Platinum plan and buy contacts one year and frames the next. The Platinum plan is the better value of the two. Nothing wrong with the Gold plan. The Gold and the Platinum have the same exact network of providers you can see. Same $10 copay for an eye exam, same $25 copay for lenses. It's the frequency and the allowance amount available between the two for frames or contact lenses. So enrollment is through the same ease portal that you're familiar with. This is the email that you should have received or you will be receiving. You've got a little login button here that's going to let you log in and start the process. This is the page that you're taken to, healthyminds.ease.com. This is your login. If you forgot your password, just hit this forgot button right there and it'll help you reset it. Once you get into the system, you go through the overview, dependents, Medicare, all that. You'll get into medical. If this is your first time going to this page, you can't skip past the top part of the page. It's going to ask you to either hit a check mark to indicate you would like to enroll or hit a check mark to indicate you would like to waive coverage. If you do not do that, you're not going to see any of these buttons down here which tell you, that give you the option to select something, okay? You can also hit X, which says you would like to waive coverage. For those of you who have already been through the system, it's already going to default to what you did last year, so it should be very easy for you. If you wish to make no changes, this should be a very fast process. Everything will be pre-selected. You'll get to this page, you'll see your current plan. It's all grayed out. We always like this lower rate here, but you got to mind, this is your old plan that's ending at the end of the year. And here's your new plan here on the start of the year with the new premium. Also note down here, there's a lot of links to open up different flyers, different pieces of information that can help you understand your plan, understand how to find providers and all that. On the right, you're going to see your numbers tallying up live and immediately upon making different selections. At the end, you'll get your summary. You want to make sure all this is correct. If it's not, you can hit edit. It'll jump back to the plan. And you can maybe say you just wanted to enroll you and your spouse here and not your child. Edit, and you can decline for your child. Once you're finished with that, you're going to sign your forms. It just turns into DocuSign. You'll type your signature. You will then use your mouse or your finger on a mobile device to sign your signature, hit next, and it will bring you through all the applications. You'll just tap or click in the green box to insert your signature where necessary. Be on the lookout for that ease invitation via email. That is what you are going to use to enroll. We'd like to ask everybody to get this done by Tuesday, November 26th. Certainly before you're sitting down for that Thanksgiving meal, we'd like to have this all done. If you have any questions, if you need any answers, we're here to help, and we'd be proud to do that. Thank you so much for your time. It's an honor working with you guys, and we're here to help if you need us.